Most people think war begins with a headline. It doesn't. It begins with readiness, quiet readiness in places that never stop working. Hospitals don't wait for announcements. They don't wait for permission. They don't get the luxury of surprise, because when something big happens, the first question isn't political, it's logistical. How many patients? How many hours? How many supplies? How many people can you move through one hallway before the system slows down? The strange part is this. Hospitals rarely look panicked before a major disruption. They look organized. That's what makes the signal so hard to see. The first change isn't a siren outside. It's a list, a procurement list that suddenly gets urgent. Extra IV fluids, extra gauze, extra trauma supplies. Not because anyone is predicting something, but because the system starts tightening. It's not proof, it's a pattern of readiness. Because before major conflicts and large-scale emergencies, medical systems tend to shift into a different mode. Not a public mode, an operational mode. An operational mode doesn't announce itself. It shows up as small, quiet changes that feel normal until you notice the timing. A hospital that normally runs smoothly suddenly adds an extra overnight shift. A staff schedule that was stable now has gaps filled at the last minute. A supervisor quietly asking people to be available. It's not a warning, it's a subtle adjustment. Then you see the next change. Emergency room protocols begin to shift. Not in a dramatic way, just small decisions that change the entire flow. More screening, more triage structure, more move them faster language. The hospital still looks normal from the outside, but inside, the tempo changes. And tempo is everything. A normal night has a rhythm. Patients come in, patients go out. Staff rotates. But when readiness begins, that rhythm becomes tighter, less flexibility, less improvisation, more coordination. And most people will never notice because hospitals are already in tense places. Everything always looks urgent. That's why the signal hides so well. It blends right into the noise. But there are moments when the noise becomes too consistent, when busy stops being random and starts being scheduled. A night shift nurse notices it first, not because she was told anything, but because she can feel the system changing around her. More carts moving down the halls, more supplies being staged in alcoves, more quiet urgency in the way people speak, shorter sentences, less joking around the nurse's station, more just do it. A paramedic notices it too. Emergency routes shift slightly, not officially, not announced. They're just preferred routes, the kind you pick when timing matters more than convenience. Hour 0, nothing looks wrong. Hour 6, the supply room is being restocked earlier than usual. Hour 12, the ER starts moving with a different kind of precision. Hour 18, staff is pulled into a quick meeting that ends without any details. And by then, the hospital hasn't changed, it has adapted, quietly. That's what readiness looks like. Not panic, preparation. Because the signal isn't a catastrophe, the signal is the system moving early, before the public even knows there's a reason. And once a hospital shifts into readiness, it rarely does it for no reason.
It starts quietly, a feeling more than a fact. By the next day, the pattern becomes clearer. Not to you, not to the public, to the people inside the system. Because the signal isn't one single change, it's multiple systems tightening, all at the same time. Procurement speeds up, schedules start to compress, protocols once flexible become rigid, structured. Nothing is officially wrong, no alarms are sounding, but the hospital begins to behave like something might be coming. And that's the crucial difference between normal operations and a state of readiness. Normal operations react to what's happening right now. Readiness pre-positions. It stages resources before they're ever needed. And that's why it feels so unsettling if you're on the inside. It suggests the system is preparing quietly while everything on the outside still feels perfectly normal. The truth is simple, though. Hospitals prepare early because they have to. A medical system doesn't survive on luck. It doesn't survive surprises. It survives on coordination. And coordination always leaves footprints. You just have to know where to look. It starts with a sudden increase in orders for the most basic essentials. Not exotic drugs or high-tech equipment. Basic things. The stuff that keeps people alive when the volume of patients suddenly surges. IV fluids, bandages, sterile supplies, medications that absolutely cannot be missing at the wrong moment. And when those supply orders go up, staffing always follows. More shifts appear on the roster, more coverage, more people on standby just in case. And when staffing increases, the protocols tighten in response. Because the fastest way to lose control of an emergency room isn't a lack of skill from the doctors and nurses, it's a lack of flow. So flow becomes the absolute priority. Patients are moved faster, decisions get shorter, sharper. You don't discuss a case as much, you execute the plan. And all of this happens long before the public connects any dots. Because people don't notice readiness, we notice impact. But impact always comes later. The signals come first. This is why readiness is one of the most consistent patterns you can find before a major disruption. It doesn't prove a specific event is about to happen. It proves something much simpler, and maybe more important. The system is shifting. And once you understand that pattern, once you learn to recognize it in one place, you start noticing similar signals everywhere else. An unexplained increase in night flights, a sudden rash of road closures, all labeled routine maintenance. Supply routes that mysteriously change their timing. None of it is dramatic, nothing is loud, it's just synchronized. And synchronization is never random, it's alignment. These are the patterns we track, not predictions, not headlines, just the signals hidden in plain sight. This isn't a prediction, it's a signal. And signals don't ask for permission.